Since the Earth formed more than 3 billion years ago, bacteria have been the most successful life form on Earth. Their sheer number has been estimated at 5 nonillion entities. That is a 5 followed by 30 zeros. Bacteria have conquered the most diverse habitats, from the permanent ice of the glaciers to the hot springs deep inside the oceans. And they have colonized the human body. In humans, there are 2 bacteria for every human cell of the body. We could not stay alive without bacteria. They are essential to our health. In the healthy body, useful bacteria live in balance with the immune system. And in our intestines, bacteria make nutrients available to the body and produce vitamins that are essential and crucial to our health. Our good bacteria prevent harmful germs from colonizing and multiplying on our skin. This is also true in the oral cavity, which is home to almost 1,000 different types of bacteria. But what happens if the balance between the bacteria and our immune system is disrupted and the harmful germs can spread? When inserting an implant to replace a missing tooth, a space is created between the implant and the surrounding gums. This space is a new habitat that bacteria can colonize. The bacteria in the oral cavity that colonize this space are initially harmless. Only a few of them have the potential to cause disease. The body's defense mechanisms are sufficient to keep the bacteria in check. The gum margin shows little or no signs of inflammation. Careful examination of the healthy gum space, called sulcus, does not lead to bleeding. However, as with natural teeth, if bacterial plaque is allowed to accumulate, the surrounding soft tissue can get inflamed. Most patients with plaque around their implants develop gum inflammation, called peri-implant mucositis, associated with implants. As elsewhere in nature, bacteria like to attach themselves to the interfaces between solid and liquid substances. This also applies to the oral cavity and the surface of the implant, as soon as that surface is exposed. But not all bacteria are capable of this kind of adhesion. Some spherical bacteria, the so-called streptococci, can colonize the surfaces of teeth and of implants, lining up to form short chains. Other types of bacteria, in turn, attach themselves to the streptococci, for example, Fusobacterium nucleatum. These are referred to as secondary colonizers. Fusobacterium has the ability to live closely together with many other types of bacteria. Fusobacterium thus acts as an intermediary for the next wave colonizers, the so-called late colonizers. These include bacteria that can be harmful, such as Pseudomonas aeruginosa or Staphylococcus. If the lower part of an implant becomes exposed to the oral cavity, Its surface is particularly susceptible to colonization by bacteria. This is because the implant surface is somewhat rough to augment bone healing after implant placement. Together, the bacteria produce large amounts of a gel-like film, or biofilm, which is resilient and protects the microorganisms from chemical and mechanical attacks, as well as from the body's own immune response. Within the biofilm, bacteria communicate efficiently. Their communication is based on direct contact, an exchange of metabolic substances, and the transfer of genetic material. Not unlike small computers, bacteria can sense their environment and the presence of other bacteria. The result influences their attachment to the implant surface and each other, as well as the production of the biofilm cover and other chemical substances, such as bacterial toxins. The bacterial toxins and messenger substances stimulate the human body to produce an immune response. Buildup of bacterial plaque usually leads to inflammation of the gums in the area of the implant. This stage of the disease is called peri-implant mucositis. Dentists and hygienists recognize peri-implant gum inflammation by the fact that the gum bleeds easily, even during a gentle examination. Other possible signs include redness, swelling, or deepening of the sulcus to form deeper gum pockets. Untreated mucositis can develop into an inflammation of the deeper tissues surrounding the implant called peri-implantitis. The symptoms of peri-implantitis are similar to those of periodontitis, the inflammation of the deeper tissues supporting the teeth. However, peri-implantitis can progress faster and can be accompanied by aggressive bone loss. Possible causes for this are differences in the tissues surrounding the implant. Around natural teeth, collagen fibers surround the root running in different directions. Periodontitis, in its initial stage, therefore cannot easily reach the bones as the horizontal fibers protect the bone. In contrast, the collagen fibers around an implant run parallel to the implant's surface. They cannot act as a barrier against the spread of inflammation. The entire root area of natural teeth is surrounded by the periodontal ligament membrane. Their elastic fibers shield the bony dental bed from periodontitis. Implants are not protected by these fibers, meaning that peri-implantitis can penetrate to the outer edge of the jawbone quickly. Inflammation releases substances that attract certain cells of the immune system, such as white blood cells, some of which can be destructive cells called neutrophils and macrophages. Both occur in far greater numbers in the presence of peri-implantitis. Other immune cells, the plasma cells, are also found in both forms of inflammation, but their number is significantly higher in peri-implantitis. Unhindered by the presence of the parallel collagen fibers, the soft tissue inflammation moves deeper and starts to involve the bone around the implant. Messenger substances released by the cells of the immune response induce the maturation and activation of osteoclasts, which are responsible for resorbing the bone. Other immune cells produce messenger substances that activate these cells. Even the bone-degrading cells themselves produce inflammatory messenger substances under the influence of an increased amount of bacteria. All these mechanisms taken together cause the inflammation to progress rapidly. A saucer-shaped area of inflammation forms around the implant and eventually destroys the bone. Periimplantitis lesions are usually up to twice as large as periodontitis lesions on natural teeth. Healing will usually not occur without treatment. The implant may lose its hold in the bone completely or must be removed. The main goal of treatment of periimplantitis is to resolve the inflammation in order to arrest disease progression and further bone loss. Infection control is achieved by the removal of biofilm from the implant surface using mechanical, chemical, or air polishing methods. If the inflammation has already reached deeper, surgery is usually required to gain access to the implant surface for biofilm removal. It may be necessary to remove a part of the soft tissue around the implant for this purpose. Since advanced periimplantitis is difficult to treat, prevention is particularly important. Periodic monitoring of the gums ensures that signs of disease, such as bleeding and pocket formation, are diagnosed as early as possible. There are risk factors that increase the likelihood of peri-implant gum inflammation or even periimplantitis: past or present periodontitis, smoking, or diabetes. The prevailing conditions in the oral cavity should also be taken into account: lack of attached soft tissues around the implant, or excess cement or ledges on crown restorations where bacteria can accumulate and where they are difficult for the patient to remove on a daily basis. The key to long-term treatment success is to prevent the bacterial balance from being disturbed. Once the surrounding gums are firm and healthy again, patients can remove the bacterial biofilm from the implant themselves as part of their proper regular oral hygiene. Additionally, regular supportive dental care and professional biofilm management are an essential part of maintenance therapy and therefore highly recommended. If dentists, oral health professionals, and patients work hand in hand, peri-implant gum disease can be diagnosed and treated at an early stage, preserving the health of the tissues around the implant in the long term. We cannot change biology, but we can control risk factors and adjust our treatment accordingly.